Hello, my name is Schneider, and I am the Leo Block Professor of International Studies at the Korbel School of International Studies. I was inaugural Director of the Latin America Center at the Korbel School. I want to talk a little bit about coronavirus in Latin America. And, there's a range of reported cases. While the virus doesn't appear to have arrived in Latin America the same intensity as other parts of the world yet, the range of cases suggests that those numbers are set to go up quickly. There have been 2 reported confirmed cases in Nicaragua, almost 800 in Ecuador, and over 1,500 in Brazil as of last week in March. Health systems in Latin America tend to be underfunded, significantly privatized in the last several decades, which means more out-of-pocket expenses for citizens. And underfunding has become worse in recent years under austerity policies, as several governments have attempted to cut spending to win favor with the IMF or with lenders in general. Latin America, as many know, is the most unequal region in the world, and this means that the rich will access testing and treatment through the private system, but the poor will not. The poor will depend on an underfunded public system with spotty access, especially for those who live in rural areas or traditionally marginalized groups such as the indigenous or Afro-Latinos. Worse, with some countries showing up to 80% of the workforce in the informal sector, many of those who are poor can neither afford to be tested nor can they stay home. They have no unemployment coverage and will not eat if they quarantine. There are also dangerous examples of mismanagement, with Brazil's President Bolsonaro, perhaps the worst offender, repeatedly overruling the advice of his health minister and international experts by perforating stay-at-home orders with exemptions, such as those offered for religious gatherings. Less extreme, but similarly lax approaches to limiting infection appear in Mexico and Bolivia, and what joins these governments is populist disregard for technocratic experts. Other populist governments, like those in Venezuela, face crisis for another reason, as sanctions from the US have crippled the Venezuelan economy and made it all but impossible to import needed medical supplies. The migrant population faces particular risks for themselves and for the region. Migrant workers, including Latin American farm workers in the US, often operate at the margins of society with limited protections from infection, limited access to healthcare, and such low incomes that they cannot afford testing, treatment, or to stay at home. Migrants detained in US prisons face inadequate sanitation and health conditions normally, and detention facilities have been overrun by the COVID crisis, and some have been forced to release prisoners because they cannot safely house them anymore. The overcrowded and underfunded prisons of Latin America are even worse, and several Latin American countries have ceased receiving deported migrants from the US for fear that they will bring the infection with them. Indeed, the first case of a deported migrant with COVID has been confirmed in Guatemala. There are several implications of all this in economic, social, and political terms. In economic terms, the region was already facing slowdown, and the fall in world demand for Latin America's mostly commodity exports will aggravate low growth and likely tip most countries into recession. This will cause a drop in revenues, which are already weak, and increased spending associated with the mitigation of crisis will mean problems of deficit and debt. Access to capital will be difficult as most investors are seeking safety in US Treasury bonds, even at historically low interest rates. International institutions such as the IMF have allocated insufficient funds to salvage the fiscal affairs of most countries in Latin America. In terms of social impacts, one of the most significant will be in terms of gender. A higher percentage of women are in the informal sector and make a large majority of the caring workforce, both formal as in nurses and informal as in domestic workers and home caregivers. Without adequate protection, women will be the most exposed to infection, least compensated for economic losses they will suffer, and the quarantines have themselves triggered a spike in domestic violence, as women in abusive relationships have to spend more time with their abusers. There are also dangerous implications for democracy, as governments may be tempted to use the surveillance and police powers associated with enforcing quarantine to abuse civil liberties, violate democratic norms, and erode democratic institutions. The use of the military to police domestic compliance with quarantine recalls recent histories of military dictatorship and human rights abuses. The crisis comes at a critical moment for democratic institutions in the region, as Chile delayed for 6 months a plebiscite to change the dictatorship-era constitution. Brazil, the government is using the virus as an excuse to waive environmental regulations. In Venezuela, the US appeared to block efforts at compromise by indicting the Venezuelan president on criminal charges and putting a bounty on his head. And in Bolivia, where a coup deposed the elected president in November, elections scheduled for May have already been delayed to sometime between June and September. On the bright side, there are elements of hope in the region, and we can see that in Ecuador, indigenous people, some of the most vulnerable, through their organizations, have taken matters into their own hands, closing access to the rainforest, thereby preventing or hoping to prevent infection of the indigenous communities there. In addition, Cuban doctors have been dispatched to 13 other countries already, including such first world countries as Andorra and Italy, as well as many Latin American and Caribbean countries. Finally, as the crisis shows the dependence of each country on their neighbors, one hopes that such examples of cooperation will renew efforts at regional collaboration. After an uptick in collaboration in the 2000s, the most recent decade has seen increased fragmentation over such issues as the treatment of Venezuela, relations with the US, and coups and non-electoral transitions. The need for cooperation around health may rejuvenate efforts at cooperation, but one can hope that the crisis focuses attention on the many other shortcomings described here, including levels of inequality, gender violence, state underinvestment in public goods, and democratic weakness.